So this is the third video that goes along with basically an intro to anatomy and physiology and just some of the terminology and themes that we'll be following throughout the year. So the first part of this video, which is video number 3, is kind of a review of the first two that we did. So again, just keep in mind that one of my favorite things to say is structure determines function, SDF. So when we talk about anatomy, we're talking about the structure. These are the pieces, like the parts of the stomach or the parts of the heart. When we actually talk about the function, what that structure actually does, that's going to be physiology. We also talked about how most of what we'll be doing is growth anatomy, which is also called systemic anatomy. And that's where we are going to take anatomy system by system. We will do some histology, which is the study of tissues, because you have to understand tissues and how different kinds of tissues before we can talk about organs and how organs work. We also went over the hierarchy, how we start with atoms, and we'll talk about the different types of atoms, and what makes an atom and what the elements are. And then we'll talk about the parts of the cell, and groups of cells that work together are called tissues, and we'll talk about the 4 kinds of tissues. And groups of tissues that work together are called organs, and groups of organs that work together are called organ systems. And again, systemic is going to be what we spend most of our time on. It's the study of anatomy by the system. So we'll be doing the Integumentary System, which is the skin, Skeletal System, which are the bones, etc., etc. So speaking of the systems, one of the first systems we're going to look at is called the Integumentary System. And the Integumentary System are basically any covering you have in your body. And I do the Integumentary System with the different types of tissues when I'm in class. Because when we talk about tissues, we talk about epithelial tissue, which was what makes up membranes, and membranes fall into the integumentary system. Most people think integumentary system is just the skin, but it can also take place with the different membranes that we have. Obviously, the skeletal system is going to deal with all the bones of your body. You have 206 bones in your body. It gives you support, it gives you structure, it allows for muscle attachment, and is also responsible for what's called hematopoiesis. Hema meaning blood. Poiesis, like a poet, means to create. So hematopoiesis is the creation of blood, and this is done in your red bone marrow. The muscular system we'll also talk about. This is going to deal with movement and the 3 types of muscles you have. You have skeletal muscle, which is what actually moves your body. Cardiac muscle, which is found in your heart, and then smooth muscle, which is found in a lot of the other organs that you have in your body. We'll also go over the nervous system, parts of the brain, all the different types of nerves you have, what is a nerve, what's a neuron, and how they make electricity. When we talk about the central nervous system, the central nervous system is just the brain and spinal cord. All the other nerves in your body are what we call the peripheral nervous system. The endocrine system is one that some people might not be familiar with. The endocrine system are all the hormones you have in your body. When your brain needs to talk to cells, your neurons will create electricity. But when different cells need to talk to each other, they will basically pick up their phones and call each other. And these chemical messengers are called hormones. And a lot of our hormones are responsible for our feedback mechanisms. So as we talk about the different systems, we'll talk about the hormones that work together in those systems in order to make sure that those systems work correctly. The cardiovascular system is what you probably grew up calling the circulatory system. Cardio referring to heart, and vascular referring to your blood vessels. So we'll have a unit on the cardiovascular system. I tend to just talk about blood, and then I talk about the heart, and then I talk about all the different blood vessels that we have. The lymphatic system is one a lot of people might not know. The lymphatic system, you've heard of lymph or lymph nodes, but if you think about your blood vessels as being hoses or a water balloon, you know if a water balloon keeps filling up with water, it can pop. Well, you don't want your blood vessels to pop. So your blood vessels are under a lot of pressure. So sometimes water will leak out of a blood vessel in order to relieve that pressure in that blood vessel. And that water that leaks out is called lymph. So our body will then recirculate that lymph and clean it and put it back into our bloodstream. So we'll talk about what lymph is and how lymph is formed, as well as the different lymph nodes, like your tonsils, your spleen, that help filter that water before we add it back to our bloodstream. The respiratory system, again, most of you grew up knowing, it has to do with breathing and oxygen. What a lot of people don't realize is that, yes, we need oxygen for our cells to work, but our cells can work without oxygen. Not very efficiently, but they can. We actually breathe to get rid of carbon dioxide because carbon dioxide is an acid and it builds up in our bloodstream. So our brains actually tell us, hey, you need to get rid of carbon dioxide. The digestive system, again, one that you've known since childhood, it's responsible for breaking down food and giving us the nutrients that we need. Now, you guys grew up calling it the urinary system. It's actually called the excretory system. The excretory system is responsible for getting rid of what we call nitrogenous waste products. When we eat food, we break down DNA, and that puts excess nitrogen into our bodies. Right now, you're breathing in nitrogen gas, but you turn around and you breathe it right back out. Nitrogen gas is poisonous. So we have to have nitrogen in order to make our DNA and our proteins. So we get all the nitrogen we need from the foods we eat. However, leftover nitrogen is turned into ammonia, just like Mr. Clean, so our body has to get rid of it. And so that's the job of your liver and your kidneys. And so then we excrete those waste products. And then you know the reproductive system, males versus females, they're responsible for the making of our gametes, our egg and our sperm. Now, like I mentioned before, we're going to do what's called gross anatomy. A gross anatomy is where you look at the big picture. You're looking at, the body systems. Now, when we talk about anatomy, this is what we call the normal stance. The hands are palm up, you're facing forward. And so the person stands with their feet together, their eyes forward, and their palms facing forward. Now, when you look at anatomical diagrams, they're drawn as if you're looking at yourself. So even though when you're looking at this person, this looks like this is on the left side of your screen. It's actually their right hand. So when you're looking at an anatomical diagram, remember they're drawn as if you could look down at yourself. Now, some terms that you're going to see throughout this course. You're going to see the term axial a lot. Axial is referring to the main axis of the body. So basically, it would be what you call your head, your chest, and your stomach. So in the case of your axial region, you would have your cranium, which is your skull, your vertebra, which is what you call your spine, your costa, which are your ribs, and your sternum. Appendicular is referring to the bones of your shoulders, your arms, your hands, your wrist, your fingers. That's what we call your pectoral girdle. And also the bones of your hips, your legs, your ankles, your feet, and your toes. That's what we call the pelvic girdle. So when we talk about the axial region, we're looking at the parts of the body. When we're talking about appendicular, we're talking about something having to do with your arms or your legs. Now, as a human, we have to be careful with the terminology. We can't use front and back, top and bottom, because it really depends on how you are positioned. Because when you're standing up, this is your top. And when you're standing up, this would be your bottom. However, if you're lying on your back, now this becomes your top and your back becomes your bottom. So we can't use top and bottom. We have to come up with certain directional terms that you're going to see. So just a very brief explanation. You're going to see the terms superior and inferior. They are opposites. Superior also means cranial, and inferior also means caudal. Now, again, we can't use top and bottom because it really depends on how you are body positioned. So anytime you see superior or cranial, that means what you would call upward towards your head. If you see inferior caudal, as you can see here, that means downward towards your tail. We have a tailbone. So basically what's away from the head. So as you can see here, the head is superior to the abdomen. It's higher up. The navel, your belly button, is inferior to your chin. It's what you would call lower down. At the same time, we can't use front and back. Because if you're standing up, your belly is your front and your back is your back. But if you're down on all fours, now your face is your front and your butt is your back. So we use the terms anterior posterior. You'll also see them called ventral and dorsal. Okay. So when we talk about anterior, it's what you would call the front of the body, or basically your belly side. Posterior is what you would call the back of the body, okay? Or in us, the side that our spine is on. So the breastbone is anterior to the spine. It's more in the front. The heart is behind our breastbone, so it's more posterior. So superior and cranial mean the same thing, inferior and caudal mean the same thing, and those two are opposite of each other. Anterior and ventral mean the same thing, posterior and dorsal mean the same thing, and those two are opposite of each other. Now, you'll also see medial, lateral, proximal, and distal. And when you read these definitions, they look a lot alike. Medial means towards the middle. And in the human body, we consider our spinal cord to be right in the middle of our body. So medial means middle. Lateral means to the side. Well, proximal means closer to the origin body part. Distal means further away. So sometimes people might get these confused. When you're talking about something on your axial skeleton, when you're talking about something on your body, you will use the terms medial and lateral. So, for example, the heart is medial to the arm. Your heart is closer to your spinal cord. Your heart is in your body. Your nose is medial to your ears. Lateral, your ears would be lateral to your nose. Your arms are lateral to your chest, because one of these body parts that we're using in the comparison is actually in the body. If you're talking about something on an arm or a leg, you're going to use proximal and distal. So medial means close to the spinal cord. Proximal means close to like your shoulders or your hips, the body attachment point. So your elbow is proximal to your wrist. Your elbow is closer to your shoulder than your wrist is. While your wrist would be distal or further away from the point of attachment. So medial and lateral are referring to something on the body. How close are you to the spinal cord? Proximal and distal are talking about something on your arms and legs. How close are you to the shoulders or the hips? You'll also see the terms, as we're talking about lateral, ipsilateral, and contralateral. Lateral, you know, means side. Ipsa means the same. So ipsilateral would be the same side, and contralateral would be the opposite side. So as you can see here, the right hand and right foot are ipsilateral. The right hand and left foot are contralateral. Now, we also have superficial, which is external, and deep, which is internal. So superficial means you're closer to the skin. Deep means you're kind of buried down inside. Okay. So the skin obviously is superficial to your muscles. Your muscles would be deep to your skin. These are just some terms that you're going to be seeing throughout, but we'll get to those later. We also have to talk about body planes. Now remember, we consider our spinal cord to be the straight up and down middle. If you were to take a tape measure and measure from your belly button to the top of your head, it's about the same length as if you were to go down. It's not always perfect, but it's about the same. So we consider our belly button to also be the center point. So we talk about these things called planes. It's basically, if I were to cut you open, how many different ways can I cut you open? The first one is what's called a coronal plane or a frontal plane. In that case, let me draw a little stick figure. Here's my little stick figure. If I were to take a knife and cut you right across the top of your head, so I basically separate your front from your back. That's what's called a frontal plane or a coronal plane, because you're cutting along what's called the coronal suture. The coronal suture runs from your ear across the top of your head over to the other ear. So when we talk about a coronal plane or frontal plane, it's as if I'm going to separate your front from your back. Kind of think of it as like a sarcophagus, a mummy's tomb, how we can open it up, and then there's a front to part of the sarcophagus and the back part of the sarcophagus. You can also have what's called a sagittal plane. Sagittal planes cut you so that you have a left side and you have a right side. So it can also be called a mid-sagittal plane. It can be called a median plane. All these things are pretty much the same. So on this page here, you can see the medial plane right here. I'm going to cut you right down the middle. Okay. So basically, sagittal would be as if I were to cut you right, I would cut your spine. So right down your spine. So you have a left side and you have a right side. Now you can have a sagittal plane. It simply means I cut you so that you have a left side and a right side. Mid lets you know that I'm cutting you exactly right down the middle. You can also have what's called a transverse plane, or it's also called a horizontal plane. That's if I were to cut you like at your belly button, so you have a top and you have a bottom. So remember, frontal plane cuts you so that you have a front and a back. A sagittal plane cuts you so you have a left side and a right side. A transverse plane or a horizontal plane cuts you so you have a top and a bottom. Now, you might see an oblique section. This is not something we really talk about. This is it kind of divides you at an angle. You might see this every once in a while, but again, it's not something we usually use. Now, we also need to talk about, or we'll be talking about throughout the year, our body cavities. We have two body cavities, main body cavities. One is our dorsal body cavity and the other is our ventral body cavity. You now know that dorsal means the back. And so in the case of our dorsal body cavity, in this picture, it's everything labeled in yellow. And our ventral body cavity, which you call the front, is everything that's labeled in red. In the case of your dorsal body cavity, it holds your brain and spinal cord. It is continuous. There's no separation. You know that your spinal cord directly attaches to your brain. So as you can see in this picture, we take your dorsal body cavity and we divide it into two parts. We have the cranial cavity, which holds your brain. And we have the vertebral cavity. You'll also hear me call it the spinal cavity, and that holds your spinal cord. But as you can see here, it's all one continuous body cavity. That's different from your ventral body cavity. In the case of your ventral body cavity, your diaphragm separates this into two main cavities. The diaphragm is your breathing muscle, and it is found right here. You can see that color change. And so above the diaphragm is your thoracic cavity. Below the diaphragm is often called your abdominopelvic cavity. Abdominal referring to your abdomen and pelvic referring to your pelvic region. So some people will say it's divided into two cavities. Some people will say it's divided into three cavities. But in the case of your ventral cavity, the diaphragm is the dividing point. What you would call your chest, above the diaphragm is your thoracic cavity, and below your diaphragm, what you would call your belly is your abdominal cavity and your pelvic cavity. Now, in the case of your thoracic cavity, your chest, this holds your two lungs and your heart. Now, your abdominal pelvic cavity, which is also, like I said, the abdominal cavity and the pelvic cavity, holds what you would consider most of your guts or your internal organs. Now, this cavity can actually be divided into 12 different sections. Now, I'm going to skip over these next few because we're not going to talk about the serous cavities until later on. And we're going to look at other body cavities as well. The oral cavity is what you call your mouth. We'll do that with the digestive system. The nasal cavity is what you obviously call your sinuses, your nose. Your orbitals, those are your eye sockets. Your middle ear cavities, that's where the bones of your ears are found. And the synovial cavities are going to be spaces between your joints. So we'll be talking about all these as we go. But what I really want to focus on is your abdominal regions. You can take your abdominal pelvic region and divide it up into 9 different sections. Now, remember, when you look at these pictures, this is the right side of the diagram, and that's the left side of the picture, because it's drawn as if you were looking down at yourself. Now, most of you know your belly button is where your umbilical cord was attached. Your belly button is actually a scar. So therefore, right there where your belly button is found, we call that your umbilical region. Now, a lot of people, if I were to ask you, show me your stomach, you would put your hand on your belly button, which is incorrect because your stomach, as you can see, is actually located more on the side. So, but a lot of people don't realize that. And the root word gastric or gastro refers to the stomach. The root word epi means above. So epigastric means above the stomach, and hypogastric means below the stomach. So that's where that middle column gets its name from. Now, if you were to take your fingers and put them on your umbilical cord and take them across all the way to your back, that would line up with your lumbar vertebra. So that's why this part is called your lumbar region. So you have a right lumbar region and you have a left lumbar region. Now, the four corners. You all heard of the term hypochondriac before, and you tend to think, oh, that means somebody who's sick. Well, I don't know why hypochondriacs are called that, because the term hypochondriac means under cartilage. The root word hypo means cartilage. The root word hypo means below or beneath. The root word chondra refers to cartilage. And a lot of people don't realize how far down your rib cage comes. Now, you can feel your own ribs. You can see how far down they go. But you can see how far down your rib cage runs. Okay? And you can see here's a quadrant and here's a quadrant. So the organs in these two regions are found under cartilage. And that's what the term hypochondriac means. So the right hypochondriac region and we have the left hypochondriac region. Now, the bottom, what you call your hip bone, there is no such thing as a hip bone. What you call your hip bone is actually three bones that have fused together. When you put your hands on your hips, you're touching what's called your iliac bone. So right here would be the iliac bone. So therefore, these regions are called your iliac regions. They're also called your inguinal regions. Be prepared to draw the tic-tac-toe board and name these different regions.